Hello, my name is Kevin Hickey, and I am the Palliative Care Chaplain at Beaumont Royal Oak. I have the privilege and pleasure to introduce you to the work of the chaplain and the discipline of spiritual care, an essential component of patient and family-centered care in this brief narrated presentation. This video presentation has the following objectives. 1. Clarify key terminology and concepts. 2. Review evidence supporting spiritual care. 3. Recognize spiritual needs and distress. And 4. Collaborate more effectively with chaplains, the spiritual care specialist. After watching this video, you should feel more prepared to meet the following outcomes. 1. Accurately and appropriately introduce and describe spiritual care to patients, families, and other team members. 2. Explain how addressing spiritual needs is an essential component of patient-centered care. And 3. Collaborate more effectively with chaplains and generate appropriate referrals. Let's start with some basic definitions. When we think about spiritual care and the work that chaplains do, generally two related but distinct concepts come to mind: spirituality and religion. In order to avoid confusion and potentially misrepresent spiritual care services, it is important that we understand not only how these two concepts are related, but also how they are differentiated. Here, we can see the definition of spirituality that is provided by the Joint Commission. The Joint Commission defines spirituality as a broad concept referring to the human search for a sense of meaning, purpose, and morality in the context of relationships with self, others, the universe, and ultimate reality. As you will hear throughout the remainder of this presentation, meaning and relationship are the two foundational aspects of spirituality. You may also notice that according to this definition, spirituality is not tied to any specific religious identity or specific beliefs. Through this definition, we can say that everyone, regardless of religious identity or lack thereof, can in some sense be said to have some type of spirituality, in that all humans, whether from a religious, psychological, or philosophical point of view, share a universal need for meaning and connection in order to flourish. When we refer to religion, we refer to a belief system to which an individual adheres. Religion involves particular rituals and practices, the externals of our belief system. Not everyone is religious, nor is religion a requirement for spirituality. This last point helpfully reminds us again that while spirituality and religion are related, they are not the same and not interchangeable, and that any particular individual or patient does not need to subscribe to a particular religious worldview in order to have spiritual needs or benefit from the support of a chaplain. In fact, almost 23% of the population identify themselves as religiously unaffiliated, including atheists and agnostics. Another possible way to think about religion and spirituality is to imagine a religion being like a pair of color-tinted glasses. A religious worldview colors how one sees the world through particular beliefs and meanings, ethical and moral commitments, ordering of relationships, symbolic interpretation, and a defined set of particular behaviors and practices. All of these elements are both consciously and unconsciously invoked by patients and families, both in times of health and wellness, but also in times of illness, stress, uncertainty, and grief. Our last basic definition describes the aim of the discipline of spiritual care. Spiritual care provides interventions, individual or communal, that facilitate the ability to express the integration of the body, mind, and spirit to achieve wholeness, health, and a sense of connection to self, others, and a higher power. Spiritual care involves promoting an individual's personal integrity, interpersonal relationships, and search for meaning. Spiritual care is based on empathy and non-judgmental love. It affirms the worth of each person. It responds to both religious and non-religious needs. It involves the humanistic desire to be there and listen to another. It acknowledges the dignity and nobility of life, and it respects each person up to the point of death. Over the past 30 years, there has been an increasing amount of research conducted to investigate the spiritual experience of patients, and for some, how religiosity or religious participation in practice can affect and impact our health and well-being. The model of human health and wellness that we have come to understand is multidimensional and is commonly referred to as the biopsychosocial spiritual model of health, incorporating these interrelated and interdependent facets of our lives. The following bullet points are all insights that have come out of empirical research that has been conducted, and from that body of research, we have learned that many patients, about 41%, say they want to discuss their religious or spiritual concerns in the healthcare setting. Spiritual support is associated with improved quality of life, and spiritual care has been shown to have a potential positive impact on pain severity. We have also learned that 87% of patients call spirituality important in their lives, whereas between 51 to 77% consider religion to be a high priority. Patients and families prioritize spirituality within healthcare settings, and in a large study of over 3,000 inpatients, found that those who reported that their spiritual needs were met were more likely to be satisfied with their care. Since 1998, emotional and spiritual needs have ranked second on the National Inpatient Priority Index, a composite ranking of hospital performance and patient importance compiled from surveys of approximately 1.4 million patients. Research has also found that when spiritual needs are addressed, patients tend to have less aggressive care, more hospice use, lower rates of ICU death, and lower care costs at the end of life. Patient satisfaction scores may be positively impacted, and patients and families tend to express more trust in their medical team. While these insights show several benefits to patients and families when we listen for, respond to, and address spiritual needs, there are benefits you, as a healthcare professional, may also experience. For example, when we form a therapeutic alliance with the patients and families that we serve, empower patients and families to participate, to define and articulate their goals of care, and engage them in shared decision-making, a key component of patient and family-centered care, often resulting in patients and families feeling more confident, secure, satisfied, and trusting, then we as healthcare professionals are more likely to feel energized, find more meaning and fulfillment in our work, and in some cases, either prevent or mitigate against such challenging and potentially draining phenomena such as emotional exhaustion, compassion fatigue, moral distress, and burnout. So the takeaway here is that by serving and caring for patients in a holistic way, including listening to their spiritual needs, we also care for ourselves and at the same time promote our own holistic health and well-being. We've heard now a few times already the phrase spiritual needs. The table on the screen now and the next table on the following slide outline some of the major broad categories of spiritual needs in the dark blue column on the left, with some more particular examples provided in each of the bulleted points in the column to the right. Spiritual needs related to religious practice may include to participate in religious or spiritual services, to read spiritual or religious material, or to have someone pray with or for oneself. Spiritual needs related to appreciation may include the need to experience and appreciate beauty, nature, or music. Spiritual needs related to meaning and purpose may include to find meaning and purpose in life, to find meaning in suffering, and to make sense of why this has happened to oneself. Spiritual needs related to love and belonging may include the need to give or receive love, to be accepted as a person, for companionship, for compassion and kindness, and to feel a sense of connection with the world. In my work as a palliative care chaplain, I frequently notice and assess patients' yearning to move towards greater fulfillment in the meaning and purpose category and also the love and belonging category. In fact, you may have already witnessed or experienced a patient or family you cared for wrestle with some of those needs as well. For someone who may find it challenging to find meaning in their suffering or to make sense of their experience, that particular stressor could be expressed through a sense of lament, questioning of one's own belief or convictions, or existential confusion. Perhaps you have heard someone cry out before, "Why do bad things happen to good people? It's not fair." Or, "I feel like God is punishing me." While people can occasionally find adaptive ways to cope by themselves or through a supportive network of family, friends, or a trusted spiritual advisor, they may also find value in a visit with one of the chaplains who can engage them in a non-judgmental, non-anxious manner, listen to validate their fears, worries, or concerns, provide an empathetic and compassionate presence that helps facilitate patients to emote and process their various spiritual needs. Some further types of spiritual needs include particular needs that often surface closer to the end of life, such as the need to address issues before death and dying, to address concerns about life after death, to review one's own life, and to forgive oneself and others. The last category of gratitude, hope, and peace, expressed by various needs such as the need to be thankful or grateful, the need to feel hopeful, the need to keep a positive outlook, or the need to feel a sense of peace and contentment, are common and seen across all clinical areas and service lines, but can be especially prominent in more acute settings such as intensive care, emergency medicine, pediatrics, oncology, and transplant medicine, to name just a few. At the beginning of this video, we defined a few foundational concepts such as spirituality, religion, and spiritual care. The phenomena and experience of spiritual distress, defined as the impaired ability to experience and integrate meaning and purpose in life through connectedness with self, others, art, music, literature, nature, and a power greater than oneself, is the primary reason we have a dedicated team of chaplains employed throughout the health system. Spiritual distress may be evidenced by questioning the credibility of one's belief system, which may sound like, "Why me?" or "What did I do to deserve this?" or "God doesn't hear me." Demonstrating discouragement or despair, inability to practice usual religious rituals, feeling a sense of spiritual emptiness, showing emotional detachment from self and others, or alteration in behavior and mood evidenced by anger, crying, withdrawal, preoccupation, anxiety, hostility, or apathy. While any of these can certainly be emotional or social challenges that can potentially interfere with medical care, they could also be indicators or symptoms of deeper underlying unmet spiritual needs. Studies have shown significant spiritual distress reported in the following patient populations. On average, about 28% of cancer inpatients, almost 41% in cancer inpatients undergoing chemotherapy, and about 65% of older inpatients. For instance, when thinking about the spiritual experience of older inpatients, of which 65% on average report spiritual distress, this patient population may often experience multiple spiritual stressors such as worries, concerns, or fears about declining health, resulting in a loss of independence, a shift in or loss of identity, an inability to perform or fulfill previous social expectations, roles, or responsibilities, possible anxiety about death and dying or fear of associated pain, existential concerns about their destiny or fate, concern about the safety and wellness of family they expect to leave behind after they die, possible past regrets and guilt, sadness and grief over past losses or anticipated losses, and possible depression from isolation or loneliness. When considering any of these possible stressors and realizing that many older patients experience multiple stressors simultaneously, it becomes evident how this particular population seems to be at a significantly higher risk for spiritual distress. We have learned from what researchers have gleaned that spiritual distress is associated with greater psychological distress and diminished levels of well-being, and that people who score higher for spiritual distress are more likely to experience pain, more likely to be depressed, could be at a higher risk of suicide, and have more clinically impactful anxiety. Nursing has long been associated with spirituality and alleviating suffering and healing, if not curing. One can argue, based on modern nursing's founder, Florence Nightingale's statements in Notes on Nursing, that caring for the whole person, including one's spiritual needs, has been at the heart of the nursing discipline since its founding. Resonating through to the 21st century and contemporary nursing practice, many nurses find deep fulfillment and meaning in caring for the human spirit. Reflecting this attitude, the Nursing Interventions Classification, first published nearly 30 years ago in 1992, is a comprehensive, research-based, standardized classification which describes the interventions that nurses perform in service to patients and families, and includes 42 interventions for spiritual support and spiritual growth facilitation, including utilizing tools to monitor and evaluate spiritual well-being, being open to patients' expressions of concerns, encouraging conversations, assisting in exploration of beliefs related to healing, and referring to spiritual care services. While not all nurses may feel comfortable or confident to competently offer all 42 types of spiritual interventions, most nurses already do offer some of the select interventions listed here, although they may not interpret these interventions as necessarily being spiritual. Let's take a look at the last intervention listed here in a bit more detail, referring to spiritual care services. The standard admissions screening protocol includes a simple and brief screening tool to inquire about a patient's spiritual needs. This tool can help the nurse better understand a patient's desire or possible need to meet with a chaplain. This screening tool normally only takes a few moments to complete and is comprised of 3 to 4 questions. The first 3 questions are a binary yes-no type question. Do you have any fears or concerns related to being in the hospital? Do you have any religious or cultural beliefs or traditions that you would like us to be aware of? Would you like me to contact the hospital chaplain for you? If a patient or family member is not knowledgeable about what a chaplain can offer, question number 3 offers a short script that the nurse can read back that states, spiritual care chaplains are able to talk about thoughts, values, feelings, and beliefs related to your spiritual needs. They will assist with providing religious resources for any faith, tradition, or spiritual practice. If the patient requests to see a chaplain, or you assess that an intervention from a chaplain may be helpful, question number 4 provides several possible reasons available to select before generating a consult order or referral, such as chaplain visit, prayer, someone to talk to, Bible or Quran, communion, anointing of the sick, confession, rosary, Sabbath candle, contact my religious community, advance directives, or other. In this final section, we'll learn about the professional chaplain to better understand the chaplain's scope of practice and how chaplains function as core members of the interdisciplinary team as the emotional, relational, and spiritual specialist on the team. Professional chaplains are religiously and clinically trained clergy or laypersons whose work reflects sensitivity to multicultural and multi-faith realities, respect for patients' spiritual or religious preferences, understands the impact of illness on individuals and their caregivers, are knowledgeable of healthcare structure and dynamics, have accountability as part of a professional patient care team, and also have accountability to their own faith groups. As the hospital community is a diverse microcosm of our larger pluralistic society, so are Beaumont's various spiritual care departments. For example, the Royal Oak Spiritual Care Team includes a spiritually and religiously diverse staff that includes, but is not limited to, several Protestant Christian chaplains with various denominational backgrounds, a Roman Catholic priest, a full-time Orthodox Jewish rabbi, and a Zen Buddhist monk. Beaumont Dearborn employs among their staff a Muslim chaplain and is also proud to employ one of the first and few board-certified Hindu chaplains. Another important point to remember here is that professional chaplains will never proselytize or attempt to impose their own religious beliefs or values onto anyone. In fact, chaplains are mandated by our professional code of ethics to protect patients, family members, and staff from spiritual intrusion. Rather, the chaplain's job is to help patients and families recall and utilize their own spiritual and, if applicable, religious resources, strengths, and coping methods to adapt to whatever challenge or crisis they may face. The symbolic power of the professional chaplain can constitute a powerful reminder of the healing, sustaining, guiding, and reconciling power of religious faith. The professional chaplain reaches across faith group boundaries and does not proselytize, but again protects patients from spiritual intrusion. The professional chaplain provides supportive spiritual care through empathic listening and can design and lead religious ceremonies and rituals. Chaplains serve as members of patient care teams, and chaplains can also lead or participate in healthcare ethics programs. Chaplains are trained, equipped, and ready to offer various interventions and supportive modalities to help support individuals and families in their times of need. Similarly to how a nurse and physician have many therapeutic tools, so do chaplains. And like nurses, chaplains carefully align their interventions according to their spiritual diagnosis or expressed need. Most people know that many chaplains often offer prayer and companionship, and while these two interventions are frequently provided, they are certainly not the only interventions chaplains are ready to provide. For example, the tools in the chaplain's therapeutic toolbox may also include various spiritual and religious rituals as appropriate, various relaxation techniques such as mindfulness meditation, guided imagery. Some chaplains have specialty training or experience in different types of psychotherapeutic frameworks such as cognitive behavioral therapy or acceptance and commitment therapy, training and certification in grief and bereavement theory or counseling, and many other tools. Common spiritual care goals and outcomes may include aligning the care plan with patients' values, helping to build relationship of care and support, conveying a calming presence, helping to establish rapport and connectedness, engaging in affirmation of faith, helping to facilitate meaning-making, preserving dignity and respect, promoting a sense of peace, and exploring spiritual and religious beliefs. In this photo, a chaplain is offering a ritual blessing of the hands to a nurse during Nurses Week. This ritual typically includes affirmation and gratitude for the nurse and their work. This story is one I often share that demonstrates not only a special type of spiritual care intervention, but one that also stands as an exemplary model of interdisciplinary collaboration. The two patients pictured in this photo were an interfaith married couple who were both enrolled in hospice care at the same time a few years ago at Royal Oak. The couple had just passed a milestone 60th wedding anniversary just before New Year's, and based on the relationship and partnership between the nursing staff, the chaplains, and the couple and their family, we learned that designing a ceremony to honor their life together would help meet a significant spiritual need for both of the patients and their family. The nursing staff, collaborating with the chaplains, physicians, transportation, the Department of Patient and Family Experience, along with support from hospital administration, were able to help realize this very special and meaningful renewal of vows ceremony at the end of this couple's lives. This is just one example that showcases the positive impact interdisciplinary spiritual care can provide when we listen to our patients' stories and hear the underlying spiritual needs. In summary, Spirituality and religious faith impact physical and emotional well-being. Patients repeatedly indicate they want their spiritual needs and concerns addressed in their care, and all partners in care, including you, play an important role in identifying emotional and spiritual distress and can compassionately companion individuals as they traverse difficult life challenges. More information about spiritual care and spiritual care departments can be found on the Beaumont intranet under the Departments tab. From the Spiritual Care intranet page, you can find contact information for all the spiritual care departments throughout the health system. I would encourage you to reach out to your local spiritual care department, meet the chaplains, and learn of their available services. As this presentation comes to a conclusion, I'll leave you with a parting reflection from Dr. Rachel Naomi Remen. Seeing yourself as a fixer may cause you to see brokenness everywhere, to sit in judgment of life itself. When we fix others, we may not see their hidden wholeness or trust the integrity of the life in them. When we serve, we see the unborn wholeness in others. We collaborate with it and strengthen it. Others may then be able to see their wholeness for themselves for the first time. If you're interested to learn more about spiritual care and nursing, there are several excellent resources available. Healthcare Chaplaincy Network published a white paper in March of 2017 entitled Spiritual Care and Nursing, A Nurse's Contribution and Practice. The same organization also has a freely available handbook of patients' spiritual and cultural values for healthcare. And lastly, the George Washington University Spirituality and Health Online Education and Resource Center has many excellent resources as well. If you're interested in further reading about spirituality, here are several books you may find of interest. Again, it's been my privilege and pleasure to share with you this information about the work of the chaplains and spiritual care services. I wish you all the best in your career and your practice. Thank you.